I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos discussing the prevention and treatment of diseases that affect the abdomen. This week's topic is on robotic surgery. In this video, I hope to discuss what is robotic surgery, what role it may play in the future of surgery, and why it might be the best option for you or your family members. First off, I would like to offer a disclaimer that over the past several years I have gone around teaching other surgeons how to perform robotic surgery. In my role as proctor and teacher, I have received reimbursement for my time and travel through the company Intuitive Surgical. I have not in that time ever received any reimbursement to advertise on their behalf towards the public or any hospital system. In order to understand what robotic surgery is, we first have to understand a brief history of surgical techniques over the past 100 years. Prior to the 1980s, most surgical techniques were performed through what's called an open procedure. In order to perform an open surgery, a large enough incision has to be made so that we could directly visualize the organs that we were working on. And often, the incision had to be big enough to get at least one or both hands inside the patient. Obviously, with larger incisions, came a higher complication risk of wound infections, hernias, and there was obviously an increased time to return to work. Since the 1990s, there was an increased move towards laparoscopic surgery, where the surgeries were performed through small incisions, usually less than a half or quarter an inch. Instruments were inserted into the body, and through a small camera we could visualize the work that was being done. Obviously, we were taking three-dimensional structures and trying to put them onto a two-dimensional screen. Also, there was significant limitation on the instrumentation that we were trying to use. Given these limitations, some surgeries could not be replicated through a laparoscopic technique, or were very complex nonetheless. The benefits to laparoscopic surgery were that given the smaller incisions, there was decreased chance of wound infections and hernias, and usually a shorter recovery time and return to work. The downside of laparoscopic surgery was mostly secondary to the instrumentation, but often it was very difficult to dissect and suture within very tight spaces within the abdomen. The idea of robotic surgery came about in the 90s. The thought process was that a robot would be docked at the patient's side. Small instruments would go through small incisions similar to laparoscopic surgery, and the surgeon would control the robot sitting at a console a few feet away from the patient. The robotic instrumentation was developed to replicate the movements of the human hand and wrist and allowed for finer dissection and better suturing within tighter spaces within the abdomen. The robot also had two cameras on the end of its scope, replicating more of a three-dimensional view to give better visualization to the surgeon sitting at the console. After the year 2000, it became obvious that robotics was becoming the standard of care in urologic procedures such as prostate cancer surgery. The ability to dissect and suture allowed less blood loss, fewer complications, and a shorter amount of time in the hospital. Over the past 10 years, robotics has expanded to the fields of thoracic surgery, gynecological surgery, colorectal surgery, and general surgery. Surgeries that before were thought to be too complex or difficult through a laparoscopic approach were being revisited through a robotic approach. The main advantages to robotic surgery are less blood loss, less postoperative pain, shorter times in the hospital, and quicker recovery times and return to work. Historically, the downside of robotic surgery has been the cost to insurance companies and hospitals, and therefore related to patients. But over the past several years, we've done cost analysis to look at the overall costs of surgery, including the cost of complications, readmissions, and return to work. And we've shown that robotic surgery is equal to, and in some cases, cheaper than laparoscopic or open surgery. Also included in that is that nowadays almost every major hospital system owns at least one robot, making it more accessible to patients. Just know that when it comes to abdominal surgery, there are open techniques, laparoscopic, and robotic techniques. You are always best served by the technique that your surgeon is most comfortable with, especially in emergency situations. Just know that robotic surgery can be associated with less pain and quicker recovery times. And if this appeals to you, you may want to seek out the advice of a surgeon who has extensive robotic training. As always, I hope this video has been informative, and if so, please subscribe to our channel. In the comments section, please add any topics that you would like to hear more about in the future. As always, I'm Dr. Jason Bowlds, bringing you better health through better education.